Arachnophobia. Those who suffer from arachnophobia, or the dread of spiders and other arachnids like ticks or scorpions, respond strongly to these creatures. The mere sight of a spider, or even just a picture of one, might cause screams, tears, or other severe emotional outbursts. There has been discussion on the roots of this dread. Some claim it stems from heredity, while others blame societal factors. It's interesting to note that while arachnophobia is common in some areas, such as Europe, spiders are welcomed as ingredients in traditional cuisine in other areas, such as Papua New Guinea and Cambodia. A fascinating arachnophobia mythology concerns St. Patrick of Ireland, who was rumored to have been afraid of spiders. The story goes that one fateful night, he saw a big spider, which made him pray frantically for divine intervention. By some miracle, the spider died. This incident, along with other spiritual encounters, caused St. Patrick to leave Ireland and make a brief visit to Britain. It is currently estimated that 4% of people worldwide have a similar phobia of spiders. Ophidiophobia. A common phobia that affects over 1/3 of adult people is ophidiophobia, or the fear of snakes. It's critical to understand that not all fears are unfounded or insignificant. The natural dislike of snakes felt by many mammals, including humans, is an essential survival strategy because snakes are ferocious predators. Snakes, as opposed to herbivores, only eat meat, and they will patiently pursue their victim for hours before striking. Cynophobia. The most common animal-related phobias are arachnophobia and ophidiophobia, fear of snakes. But cynophobia, the fear of dogs, is a surprise statistic given how common, since there are an estimated 62 million pet dogs in India and 25 million stray dogs in America. The frequency of cynophobia is alarming. The scenario for people affected is worsened by the lack of awareness by the dog owners, which exacerbates the problem. Astrobiphobia. Both animals and humans have the ability to develop a controllable phobia, such as astrobiphobia, or the fear of thunder and lightning, and eventually overcome these. People who experience this dread are aware of how illogical their emotions are, and the minimal risk to their safety is less threatening. A common reaction to astrophobia is shaking perspiration and terror. Some people, however, can also show unusual symptoms, such as a strong need for company and assurances of safety from others. Many people who have astrophobia watch the local weather and sometimes refrain from entering the area until they are positive there is no chance of a storm coming. Hylophobia. The fear of trees and forests, known as hylophobia, is sometimes caused by inherited tendencies or unfavorable experiences, like being lost in the woods or feeling overwhelmed by their immense size. Set fear can also come to those who find it difficult to process life events. Despite its widespread occurrence, little is known about the underlying causes of this association. Claustrophobia. Claustrophobia is categorized as an anxiety disorder, characterized by a fear of tight and compact spaces, such as automobiles, crowded rooms, or elevators. This can often cause panic attacks. Research indicates that between 5 and 10 people in the world suffer from acute claustrophobia, yet only a small percentage seek help. A common sign of claustrophobia is fear of suffocation, in which people are alarmed by their cramped quarters, as well as by possible events there. This dread and agoraphobia are related. We'll talk about them next. Agoraphobia. Agoraphobia can appear in a variety of public areas, including shopping centers, crowds, offices, and educational institutions. It's the fear of being unable to escape the situation that one sees as threatening, even when the situation is safe. People suffering from agoraphobia often take drastic measures to keep themselves away from dangerous places. In extreme circumstances, people can be bedridden or housebound. Aquaphobia. Aquaphobia is a psychological disorder that is thought to be caused by a combination of negative experiences with water and genetic predisposition. It is defined by an extreme fear of water, even in situations where there is no imminent risk. 2.3% of adults worldwide suffer from aquaphobia, while in the United States, 46% of people are afraid of deep pool waters, and an astounding 64% are afraid of large bodies of water. One specific type of fear, known as thalassophobia, includes fears about swimming in these types of waters, as well as fears about the sheer size of the sea and its aquatic life. Ablutophobia. Ablutophobia, or fear of washing and personal hygiene, is more common among women and children. People with ablutophobia, known as a specific phobia, are aware that their dread is unfounded, but they are unable to face or avoid the things that cause it. A fear of being induced into a nervous breakdown, passing out, or dying may accompany symptoms of disassociation from reality or from one's own body. Ablutophobia's origins are currently mostly unknown. However, some ideas suggest that earlier trauma may have served as a catalyst. Therapy, however, has the potential to help people overcome these concerns. Acrophobia. Acrophobia, which is defined as an unreasonable dread of heights, frequently appears even in situations where people do not feel in danger, but rather believe they are at. This phobia is classified as discomfort and space, a condition in which a person experiences extreme terror in spite of their physical environment. Some people have a head for heights, which means they don't fear high places. Many of these people enjoy outdoor activities like hiking and climbing, and their fearlessness makes them excellent candidates for jobs like wind turbine mechanics or steeplejacks. Acrophobia affects 2 to 5 people worldwide, twice as likely to have it in women as in men. Aerophobia. Aerophobia is fear of flying in a helicopter or airplane. It is sometimes referred to as the fear of flying or the flight phobia. No matter how dangerous it is to fly, the people who suffer from this fear will try to avoid it. Takeoff. Bad weather and turbulence are the parts of flying that cause the most fear in people with aerophobia. In addition, 60% of those who complain of a fear of flying also report having associated anxiety disorders. Thank goodness, a combination of medication and exposure therapy can be used in conjunction with aerophobia. Social phobia. Social anxiety disorder or social phobia, often described as a mental illness, makes people have difficulty socializing. This anxiety could be the result of expecting unfavorable attention or criticism from peers and other people, which could give rise to a persistent fear of not being accepted. Many people with social anxiety disorder turn to drugs and alcohol as coping mechanisms to help them feel less anxious. These approaches, however, don't address the underlying cause of their worry and can even make things worse. The therapy, especially cognitive behavioral therapy, is highly recommended for those struggling with these concerns. Glossophobia. People with glossophobia, or the dread of speaking in front of others, may have trouble speaking clearly and thinking clearly. Those who fear the appearance of stupid often find it difficult to communicate their ideas clearly. Techniques such as meticulous planning, encouraging self-talk, practicing mindfulness, and visualizing triumphant performances can all help reduce these anxieties and improve presenting skills. Autophobia. This problem affects many young people these days. People who suffer from autophobia feel uncomfortable in social situations, whether they're alone or with others. Autophobics fear being isolated by life's obstacles, while socially anxious people worry about not receiving enough real affection, approval, or empathy from peers. Hodophobia. Hodophobia is not a synonym for nothing like traveling. It is defined by an unreasonable fear of it. When people who suffer from hodophobia are not at home, or even if it's just an idea of traveling, they get extremely anxious or suffer crippling panic attacks. This dread is more than just a preference. It can seriously inhibit a person's capacity to participate in activities related to travel. Trypanophobia, a strong dislike of injections or hypodermic needles used in medical operations, is referred to as trypanophobia, also as fear of needle. Some people may resist necessary medical procedures or immunizations because of this fear. Trypanophobia and iophobia, or fear of sharp objects, are linked somewhat. Although trypanophobia affects 10% of the population, some surveys indicate that the true prevalence may be significantly higher. The incidence of this terrifying fear in children is increasing alarmingly. Trypanophobia affected 25 children in 1995, and by 2012 reached 65. Hemophobia. Blood phobia, or hemophobia, is a phobia which can cause extreme reactions, unlike most other phobias such as seeing blood. Severe hemophobia in the US affects approximately 4 of people, commonly the result of traumatic childhood experiences. It is interesting to note that historical personalities with strong anti-blood aversions include Emperor Domitian of ancient Rome and Queen Victoria of England. According to reports, Queen Victoria repeatedly passed out when she saw blood, while Emperor Domitian shied away from public executions and gladiatorial competitions because he detested bloodshed. Arachnophobia. Arachnophobia, or fear of doctors, is not unusual, especially among young people who might try to avoid going by, pretending they were well. Even when faced with life-threatening conditions requiring immediate attention, some adults with extreme forms of arachnophobia feel intense negative emotions at the mere thought of. This fear may be caused by a persistent resistance to accept one's disease or by fears of a poor diagnosis. Steve Jobs, the co-founder of Apple Computer, died Sunday sadly of pancreatic cancer as a result of his refusal to receive traditional medical care and instead placed his trust in complementary therapies and diets. Jobs regretfully told his biographer that he might have lived longer had he not waited for surgery. Dentophobia. Dentophobia is similar to arachnophobia, the dread of dentists. Dentophobia can be a combination of many factors, such as unpleasant dental experiences, unfavorable stories told by others, or a vivid imagination of the worst-case situations related to dental visits. Parents can also play a role in the development of dentophobia in children who are impressionable. Some complaints, like dentophobia, won't go away in a day, but can last long into the adult years. Germophobia. The fear of sickness and germs known as germophobia is very widespread and tends to worsen with age. A study released after the outbreak found that an astounding 42% of the people in the United States are germophobes. Although it is important to be aware of germs and to practice hygiene, excessive hand washing and avoiding public places out of fear of getting sick are examples of irrational conduct that can result from germophobia. In fact, being around germs doesn't always mean negative things. It can strengthen immunity and lessen the chance of allergies and common illnesses. Tell me the best way to tackle germophobia.